One way you can prevent your child from getting chronic ear infections is not allow them to go to sleep with a bottle. That change in pressure within their eustachian tube from lying down to sitting up is significant, and when you introduce a bottle into that mix, it complicates matters. So studies have shown that if you do not allow your child to sleep with a bottle, it decreases the incidence of otitis media. Other things that you can do to help your child to prevent them from having more ear infections is perhaps using some saline in the nostrils a few times a day. 1 to 2 drops of saline in each nostril will help to promote drainage, and it also has been shown to help reduce the amount of ear infections that you have. And of course, the third thing is minimize the exposure of viruses and colds. If your child is in daycare and they are getting frequent infections, it may be prudent for you to maybe take your child out of daycare for a little bit of time to allow them to kind of recover and build up their immunity to be able to fight off these infections, and then allow them to go back to daycare after some time has passed and the child is a little bit older. I know in today's day and age it's difficult to do that because people work, but oftentimes when we make this recommendation to parents and they do take their children out of daycare, or in a daycare that's a smaller environment with less children, it has very much so made a difference in the amount of ear infections that the child gets.